Tell me what you think about the healthcare bill that we saw last week.
What we saw from the healthcare bill is that it'll impact 22 million people. And not only that, I mean, Republicans seem to think that they can, behind closed doors, push a bill that hurts children, that hurts families, and, hurts people that need healthcare the most and hurts the middle class. And so what we've been doing, we've been organizing around this, making sure that people are knocking on doors, that it is making an impact in races when you're looking at 2018. There are several senators who are up for re-election in 2018, Republicans who are contemplating voting for the bill. And we're making sure that their constituents and the voters in those states know what this means for their communities. So we are encouraging people right now to make calls. We have a website. It is makecalls.dnc.org/ACA. And this is an opportunity for people to just, from their home, go ahead and contact these senators directly in their offices, because the more calls you make, the more likely they're not going to vote for it. I was talking to a U.S. senator the other day. He said that just in one day he had 1,400 calls, not even only from his state. This was from all over the country. So we need to make sure, just because we won this one step and delayed the bill, we just heard from Donald Trump today saying that, you know what, we don't need to replace ACA for now. We can just repeal it. That means he wants to just flat out take people's health care away, and who knows when they're going to get it back. And that's not okay.
Got it. Makecalls.dnc.org/ACA. The Republicans are all going to the Republicans are all going to really damage these Republican governors who are in states who manage these Medicaid programs. And they're talking about cutting $772 billion out of Medicaid. Most people, I don't know if people realize this, but the states administer the Medicaid program. So if you take that money out of the Medicaid program, it means that a governor has got to decide either to replace it, which means cutting people or cut people off of welfare, off of Medicaid, or cut benefits, or they're going to have to raise taxes or replace that money in some sort of way. So it's a really bad thing for governors.
I think it is a very bad thing for governors. And frankly, for Republicans right now, at a time when there are in states, they will see the impacts very, very soon. And with races in Virginia and New Jersey, where in New Jersey you have you have Chris Christie, who is the least popular governor in the country. This will impact New Jersey more than a lot of these other states, right? So we're making this an electoral issue so that if you're going to run on Donald Trump's agenda, we want people to know that you are for stripping people away from their health care.